Next thing I want to just cover is that in 2012, you know, the other big thing that we see happening is that the Department of Health Services announced their sustainability plan, which was called for by the audit. And it said it would be seeking reforms and savings measures that they believe would help make the program sustainable on an ongoing basis and keep it consistent with the interests of current and future program participants. And they held town hall meetings around the state in March of this year. They had looked at a number of different areas in which they were going to make some of these changes. The one we're going to focus on is on residential services because that seems to be the one that's being targeted the most right now. Now, I asked a really direct question to the Deputy Secretary last week when we met with her and her staff and the Executive Assistant to the Governor, Kevin Moore, on this topic. And I asked, well, are you requiring the MCOs to make these changes right now? Because they've targeted $14 million in savings. Now, $14 million in general purpose revenue, which is the state dollars, actually draws down additional dollars from the federal government. So you get a 40-60 share there. And so it would really be a cut of about $36.4 million in all funds, including the federal share. But what they said was it wasn't for people who are currently receiving services. It was only supposed to be for those people who are going forward who they wanted to make these changes for. They did have a quote. They actually specified, you know, pretty plainly. It said the costs of care provided in residential settings, which includes adult family homes, community-based residential facilities, residential care apartment complexes, and assisted living, is a significant cost driver in family care, IRAs, PACE, and partnership. So clearly they believe it's, and when you look at the graphs, it is the very largest cost that family care bears is in residential services. So one of the plans, I'm going to point out a couple of them, was to support more integrated, cost-effective options in place of 24-hour-a-day, 7-day-a-week staffing. One of the ways they talked about doing that, I think, actually makes some sense, and that is that they talked about doing more electronic monitoring. So they're talking about using technologies such as alert systems and rapid response for supports for people with an intermittent and or unpredictable need for supports. Now, this is something that was piloted actually in Dane County. They have what's called the sound response system. They always had an open line, you know, like a phone line where they could actually monitor somebody who could get along without having staff there overnight if they were simply being monitored for their needs. And they set up a response system that was based in their fire departments over there in Madison. And so if somebody had a need, they could pretty much get somebody there within just a few minutes, like 3 to 4 minutes. So they want to do more of that. They talked about assistive technology. One of the things that many people questioned was their idea that they would use medication management systems to assure accurate use of prescription drugs, kind of these automatic dispensing systems. And they thought that was going to save a lot of money. There's been some controversy about that. The other thing they talked about was developing more effective housing options for people with long-term support needs. And this seemed like a pretty loose area, but basically what they wanted to do at the bottom line, at the last dot point there, says that they wanted to transition family care from primarily using licensed regulated settings to supporting people in their own homes or apartments with services from a provider who is not also the homeowner. Now, that's been kind of a trend in our field for a long time. You try to separate supports and services from housing, because in a group home kind of setting, you've got them both bundled together. It may not be appropriate for everybody.